Perfect. Okay. Assalamu alaikum. Welcome to the Lifesavers event. This is held by the British Islamic Medical Association. So my name's Hussein. I'm I'm a doctor at Royal Preston Hospital, and these are my colleagues. So if you'd like to introduce yourself. Sorry?
So my name is Fakir. I'm a fourth-year medical student, and I work in Blackburn and Birmingham.
I'm Sufyan, fifth-year medical student here.
So the British Islamic Medical Association, we're basically a group of healthcare practitioners that volunteer to serve the community, increasing health awareness within the community, and also advocating for our community within the healthcare setting. These are just some of the events we've run in the past. So this includes things like coronavirus discussions on organ donations as well. And Lifesavers event, it's been going on since 2014, and alhamdulillah, since then it's increased, and it's not only in the UK now, it's run all across, so Pakistan, Nigeria, Bangladesh, and it's on the same day every year. So the aim of this event essentially is to give you the skills to, inshallah, hopefully, let me get back to the slide, sorry. Inshallah, so as explained by this ayah in Surah Al-Ma'idah, which is translated as, whoever saves one, it is as if he had saved all mankind. So hopefully with today's presentation, you can learn these skills and put them into practice. And if ever there's a scenario where you might have to use these skills, then you can hopefully gain the rewards of almost saving all of mankind. So why learn basic life support? Essentially, basic life support is needed when you find someone that's collapsed and they're unconscious, and it's a group of skills that you can use to make a difference and potentially save lives. Basic life support itself is quite simple but very effective, and it can have a massive impact on the person's life. So for example, most collapses occur outside of the hospital. So around 88% of cardiac arrests occur within the community. So that could be on the street, at home, it might be a loved one. So it's very useful to know what to do in that setting. Also, cardiac arrests affect men more than women. So given that we're all men here, I think it's good to know. What is a cardiac arrest? So essentially, a cardiac arrest is when the heart stops beating due to the electrical activity within the heart having an issue. And what that causes is reduced blood going to the brain, which leads to collapse and unconsciousness. And this differs to a heart attack. A heart attack is when the blood doesn't receive, where the heart doesn't receive enough blood supply, and therefore that causes damage to the heart. So in this BLS basic life support setting, these skills will be used for a cardiac arrest and not a heart attack. So within our communities, we have a genetic predisposition to develop coronary heart disease compared to a white European, and we're also more likely to develop diabetes, which can also lead to cardiovascular disease. And these factors put together make us more at risk of cardiac arrests and a heart attack. So would you know what to do if you came across someone that had collapsed on the street randomly, or a loved one at home collapsed? Well, hopefully, inshallah, after today's program, this event will give you the basic knowledge and confidence to know what to do initially. Unfortunately, only 2 in 3 people across the UK would attempt CPR if they saw someone have a cardiac arrest. And this might be due to multiple reasons. Possibly they don't have the confidence, they lack the knowledge or the skills to do so. And the way we'll teach this is through 3 simple steps. So first we'll show a video demonstration on the presentation, and then we'll demonstrate it physically, and thereafter we will practice in small groups and supervise these skills. So the 3 skills that we will be teaching today will be CPR, recovery position, and choking, and we'll go through when you'd use each one. So CPR, cardiopulmonary resuscitation, this is used when you find a person that is unconscious and not breathing. There's a chain of survival to increase the survival rates across a person that has collapsed, basically. So early recognition, so recognizing someone is unconscious and isn't breathing, and thereafter starting CPR as soon as possible, moving on to defibrillation, and if the person survives, post-resuscitation care, which means the person needs extra attention to ensure good outcomes. So on average, it takes 8 minutes for an ambulance to reach someone that has collapsed. In today's setting, it might be even worse given the waiting times and the strain on the health service. So it's worth knowing what to do in such a scenario. The chances of survival from a cardiac arrest decreases by each minute. As you can see, from 1 minute it's at 90%, and all the way to 8 minutes you're at 20%. And that's minutes to delivering an electric shock to the heart. This is a defibrillator. These can be found across many settings. You can find some in like supermarkets, in airports, and these are life-saving interventions. These can also be located when you call 999, and they can let you know where the closest one is. So before getting to defibrillation, someone needs to do CPR, and without CPR, the chances of survival decreases massively. In terms of CPR itself, what you do is there's 5 steps essentially. Sorry, 6, can't count. So 6 steps, and it can be summed up using DRS ABC. First, starting off with danger. So first of all, you have to make sure you are safe yourself before attempting to help someone else. So the things that you'd be looking for in terms of ensuring safety would be any sort of spillages or electrical cables that you could trip over. The next thing would be response. So the person that has collapsed, you check for any signs of life there. So maybe shake a shoulder, ask them, can you hear me? If there's no response and they're not breathing at all, then you move on to shout. So this is where you shout for help. Ask someone to call 999, and this allows you to carry on with CPR. The 3 steps for CPR are airway, breathing, circulation. First of all, you start with the airway, so A, and this is where you make sure the person's airway is open. This can be done by tilting the chin and moving the head back slightly. This opens the airway and prevents any sort of blockages from vomiting or a tongue obstructing the airway. The next thing is breathing itself. So this is where you check for breathing essentially, and move on to chest compressions. So chest compressions, you start and essentially what you do is find the middle of the chest underneath the armpit, and it's right under the breast, almost at the breastbone, and this is at a rate of 120 compressions per minute, which is essentially 2 a second. And chest compressions, you go down 5 to 6 centimeters in depth, and we'll show you what that entails in a moment. And then after you've done 30 chest compressions at a speed of 2 per second, you move on to mouth-to-mouth or rescue breaths. Now, during COVID, this was removed, but if it's a loved one or someone that you know and you're happy to do so, then you can carry out rescue breaths, and these are 2 breaths that you give. And these are rescue breaths explained. So you open the airways by lifting the chin slightly, moving it back, pinch the nose and give 2 breaths, watching for the chest rising, which would indicate good rescue breaths. All right, we're having a bit of technical difficulty. I think it's just not connected to the internet. Sorry. You sure? I think I should be all right with it. I'll get it up there. That should be working now. So this video will explain CPR in a bit more detail and how it's carried out.
I think it would be the speaker. I don't know because it's HDMI.
Says.
Organs. It's time to act. Every minute without CPR will significantly reduce their chance of survival. Shout for nearby help and always check for danger before approaching the person. Shout at them and gently shake or firmly tap their shoulders to check for a response. Check their breathing. Current guidance recommends looking for the rise and fall of their chest. Do not place your ear or cheek close to the person's face. If they aren't breathing or not breathing normally, call 999 and explain what has happened. If on a mobile, put it on speaker. The emergency call handler will talk you through how to perform CPR and tell you if there is an automated external defibrillator or AED nearby. Send someone to fetch it, but don't leave the person if you are on your own. During times of increased risk to the rescuer, we recommend placing a cloth or towel over the person's mouth and nose before starting compressions. It's time to give the heart a helping hand. Place one hand on top of the other and interlock your fingers. Place your hands on the center of their chest and begin pushing hard. Aim for 2 beats per second and do not stop unless someone can take over, you are exhausted, the AED arrives, or the emergency call handler tells you to. If an AED arrives, this device can give an electrical shock to help restart the heart. It will talk you through the whole process, so listen carefully to the instructions. Continue CPR until the person shows signs of life, the AED advises another shock, or until a paramedic takes over. CPR gives the person their best chance at life. Learn CPR for free by playing Lifesaver at lifesaver.org.uk.
Hopefully you could hear that one. So now we can split into groups and do the CPR demonstration itself. First we'll show you how it's done between each other. Is that okay? Yeah. And then we'll split into groups. Right. Yeah.
So first we check for any danger, is anything around the person or around you. And begin by shaking your hand. Hello, can you hear me? Can you hear me? And then you shout out, can I get some help over here? Hopefully someone would come over. And then you would go on to tilt the chin, to open the airway, and you could see if you could feel the pulse in the neck, as well as check if the chest is rising or not. And obviously, if you couldn't feel the pulse and there was no sign of life or any sign of breathing, then you would look to start any CPR. So, as I said in the video, so you start with the heel of one hand around the sternum, so directly between the pecs or the breast essentially, with the other hand locked in, and then you would press down 5 centimeters and try to do it at 2 beats per second. And then if someone was to come and help, someone around you, you would then ask them to ring the emergency services, saying that there's a suspected cardiac arrest, and depending where you are, in a mosque or anywhere else, you would ask that person to see if they could get the defibrillator, which is mentioned in the video, and whilst they will do that, you continue chest compressions until that arrives.
Yeah. Perfect. So we can do the practical now on CPR. We'll get the pillows.
I'm just wondering, would we divide ourselves into two groups? I take one and you take one. Yeah? Okay, yeah. So, a few quick points. CPR does not stop until someone is hospitalized. By someone, I mean the paramedics. So, let's try to keep compression, keep breath, keep going until it's time. We don't stop until then. And
help. So, I can show you how it's done first. Just to take off. Actually, I'll do a quick run through of what we've done previously. So, you come across someone that's on the floor, look for danger, so danger is typically able on the floor. And then
I want to just across the site right next to the patient. The person.
the patient or the person.
This is the chest
So,
line.
can you hear me?
In the middle of it.
Spot.
So I'm assuming.
Check.
Well, I
sign
sign
of
three
breathing.
nipple line, so I know exactly
No
central.
signs of breathing.
One hand
The chest isn't
now,
rising at all.
the other.
Ask for help, shout for help, and some call 999.
The person lying
So
on
someone's
top, so I
got
can
to
have
go
maximum
back
pressure onto the patient.
Now you can find this go to the airway,
I straight as possible, and I
That's
go
the
5 centimeters.
tilting of the head backwards
Two, per second.
chin.
So it's
Only
only
the airway.
some people when this first done it's go
And once that's done,
that is
move on to
for
chest compressions.
We need
So
one, two.
essentially it's basically under the armpit.
We do this with stop.
Yes, of course.
We give 2 breaths, and then
There you go.
Does that make sense?
Right. So
Is there any question on this point?
just there.
So it's
So you lift your arm. Just under
2 breaths,
the armpit.
30 compressions, 2 more
Yeah.
breaths.
So I think
it's changed over there.
It's
2 and 15.
Press. I don't know if one arm like this.
5 is for choking.
The other is
I think I remember
press down.
it was 2 breaths and 15
And
at one time. I think it's got changed over the years. Was it changed by? No, it's changed over the years.
There's a lot of pressure, so keep your arms straight.
It's still for sure. This is just for
Press down.
during the
And
test.
this is
Small
a
bodies, that's all.
pressure,
So-
press down every 2 seconds, every 2 seconds. So if I was to,
Those are rescue breaths.
Every half minute.
Mouth.
so if I was to,
I'm not going to demonstrate.
No.
But I can
this is a rate to do this. So those are demonstrate on the patient.
No. Like it.
Like this. So keep in pace with that. 2
So-
seconds. Yes.
So basically in this position, imagine I have a tube, that's my airway.
So once you've done
Right now my tube is blocked. And you know air is going into. So the idea behind it is resting breath. So sorry, the resting breath.
is where
So
open, pinch your nose,
right now this is his position, right?
lift the head
Your
back
air is
slightly,
blocked. I want to put his head back so the airway is
so
open.
forward completely around the mouth,
And then the air
and that
introduces
gets
to
the
the radars.
So the air itself
and
goes
then
to the brain to the blood.
so go back
So
to
you're pumping
chest
the
compressions,
heart, which is the front, you press the blood back again.
yes.
What I'm doing now is allowing the air to enter. So right now,
So someone
if there was a tube here, the tube has
paramedic arrives.
if I lift his head up, push down here,
Yeah,
Because it is quite tight.
Yes.
Yes.
Quite,
Yes.
what's it
So
called?
now,
But if it's somebody not CPR,
so I put
then it,
his head
it's
back.
still they can do it.
Yes, definitely.
Like
It's
this.
very good.
Yeah.
Anybody can do
And
it.
then chin left, basically, I use my 2 thumbs to push it up.
I mean,
Yeah. What?
once you learn it, it's very,
Yeah.
very much.
So now his airway is open.
Also,
This is to go to the air.
30.
Now for the rescue breath,
Go
I
back
will
to
pinch
30.
those.
For the rescue breaths again.
I will pinch
doing this
those.
until someone
Form a tight seal with my hands onto
It is
this,
quite tiring.
and I would
So
push
you
in
might
there
have someone else
until
do
it's
it.
just right. And I will pinch that twice and stop.
Yes.
Yes.
about 15 seconds you'll be doing the.
Like I said, I said,
Because obviously we don't know that more which we could be doing as hard as we can. So that's what's easier, so just time yourself. Keep it on the time, so yeah, we get like, I guess it's just getting yeah. Something with some name, to live in that.
you can, it's not necessary. But you can, right? Yeah.
You be defibrillated if you get
You would see the chest rise.
Just for example,
If it doesn't, the only reason why it would be a potential obstruction. So, like, if we were to imagine it's a tube, the tube is blocked, we block the tube, and then push the air. Yes.
or if the seal is tight.
And that, yeah, to be related, you just basically place it.
And that's why we also close the doors, because it's
How can it
connected.
find any?
So if I close the doors.
Yeah, so it has 2 parts, and the parts have directions. So when you
Yeah.
so one
the first thing you do is actually
Cruise, yeah.
Yes, and the reason why we're doing the danger first is we're sending out one ambulance. If we have two patients, then there's more issues to deal with than we had at the beginning, which is why we do danger first. If everything is clear for you, then we check if the patient is responsive. You can first shake his shoulders, call out hello, hello.
There we go. What's the name? Try and hit it. Try and the first one, right over there, and then so. I guess we start the whole thing. So you go for the steady one. You start off with danger.
So from the response form, there's a few things you can check. First is breathing. Sometimes what
Yeah,
people
no,
do is if I'm breathing and
if they can't
pops
hear
up,
you,
that means the person is breathing. It doesn't need CPR. It's not breathing, it does. The other thing is sometimes you can check for pulses. One place is here. This for me is the easiest, but it can be challenging as well. You can also check on the because you're already up here, it's easier to do it, but the hand can be done as well. You can feel something, right? So it's usually if you feel it lying,
that means usually around 2 3 meters chest compression. So you kind of look at the patient from this one minute to the ground.
if you're struggling with that, just follow the thumb,
Yeah.
and then this is how you go. You follow the thumb right here.
Yeah, so that's
Yeah.
right, yeah.
You follow the thumb. Yeah.
Like this.
So that is for
And your weight is
so that would be for response. Now you would call for help. And when you call for help, ideally what you tell us is look at someone and say, please call for help, there's a potential cardiac arrest. And that would prompt them to actually call for help. Now we will start compressions. So just do those.
It's difficult to do that.
So would you mind just demonstrating
Do that.
the compressions? Yeah. Sorry, I'm making you work a lot. You go like that. You get on top of the patient.
So if you're these tests,
But this is how you do it.
yes, obviously you're not someone's body is quite deep, so you actually want to go quite deep.
So 5 to 6 centimeters is, I'm assuming that's about that, right? And 5 centimeters, even on me, it was big, is a lot. Imagine that for a small person. So it is a lot of force, it is tiring, but if you keep in your head, I'm saving this person's life, it makes it easier. Yes? Anything else? Should we do or try to practice on once, just so it makes sense?
So do this like, say, how many days? 30.
30.
And then stop it.
Stop, 2 breaths, check the breath, if the person's responsible, if not, continue. 32, 32.
And then
Until paramedics come. Sorry. You stop the chest compression, you do the rescue breaths, and then you continue the chest compression. So, ideally, you can't do both at the same time. You can't be pressing the chest and expecting the lungs to blow up as well. I like to think of the lungs as they all release. If you blow into it, it blows up. So if you're pressing on it at the same time as you're blowing it up. So, 30 compressions, 2 breaths, 30 compressions, 2 breaths. Yes.
So is it like a, do you like to get as much air
do that
yourself
because obviously
as
that's a lot of pressure.
push?
You have to
Sorry.
reduce that.
It's a smooth,
Put the same pressure on. You're
and
going
then you
to
see the chest
in
rise.
this child anyway.
One, and
It's
then
slightly more
you
complex.
do it one at a time.
So
Yeah.
it depends on the age.
Just thinking of this.
What
because
age?
if you start breathing again.
It's not leading up to about the things not seen. I mean, because there's still minor. The bones will a lot less. A lot more fragile. The other point is that they probably don't have enough muscle tissue to
Because if you get your heartbeat back, but then it goes again.
50 millimeters.
And then you get it back, then it goes again.
I was doing the same start. 5 to 6.
if you're unsure it's better to continue, then you need to stop. And with the, so if they start breathing again, that means their heart has restarted, so they don't continue pressing. But if they're breathing, then they're okay.
It's a black situation, that's why I don't really answer. Yeah, if that was a whole stop,
And just to mention with the breath as well, so say there's 2 people, one person could stay at the head, the other person would do compressions. They would do the 30, they would pause as you're doing it, and then tell them to do 2 breaths.
used when
And then you could like, if you're tired, you could do the compression, you could switch that kind of thing.
but this is the situations where you have more than one person attending. And in that case, you also try to come up with a plan in terms of, I'm doing CPR first, I'm tired now, can you please take over? And then just alternate until the paramedics come. The presentation says the paramedics come within 8 minutes, sometimes it doesn't happen. So the CPR can last for an hour of us pumping blood around the body. So this has to continue non-stop.
If obviously you're still at it, somebody else is there,
should not stop.
between you keep going,
A few minutes of a few
you
minutes.
still not had an ambulance
The
for
breath,
10 minutes.
the CPR, so
Just keep going.
yes.
Just keep going.
And if you keep doing, and then if it becomes okay, then you have to stand up or you have to roll or not let me stand up. Stand, sitting or something.
responsive, but breathing normally, put them on their side in the recovery position. This helps them to continue breathing normally by keeping their airway open and clear. For example, it stops the most common airway obstruction, their tongue, from falling back and blocking the movement of air. It also means that any vomit or fluid which comes back up can come out, rather than causing them to choke, which could happen if they're on their back.
To put your casualty into the recovery position, this is what to do. Kneel beside the casualty and get yourself in a comfortable position. Check the casualty's pockets and remove any bulky items. Remove any sharp rings, and if they're wearing glasses, take them off. Make sure that both the casualty's legs are straight. Place their arm nearest to you out at a right angle to their body, with the elbow bent and the palm facing upwards. Their arm can be placed straight out to the side if it can't be placed at a right angle. Take their other arm and place it across their chest, and hold the back of their hand against their cheek nearest you. With your other hand, lift their far leg just above the knee. Pull it up until their foot is flat on the floor. Now you're ready to roll them onto their side. Keeping the casualty's hand pressed against their cheek, carefully pull on their bent knee to roll the casualty toward you onto their side. Now their top arm should be supporting their head, and their bent leg should be on the floor to stop them from rolling over. Their top leg should be at a right angle to their body. Remove your hand from under theirs. Check the casualty's head is tilted back. This will keep their airway open and clear.
Once the casualty is in the recovery position, you should call for medical assistance if this hasn't already been done. Remember to recheck the casualty's breathing at regular intervals until medical help arrives. If it stops, you'll need to give them CPR. If the casualty has to be kept in the recovery position for more than 30 minutes, turn them onto their opposite side to relieve the pressure on their lower arm, unless their injuries prevent this.
So again, similar to last time, you found someone or you see someone collapse, you approach, check for danger. You begin with the shake and shout, hello, can you hear me? No response. Again, going over what we've covered before, you start with the head tilt, chin lift, check for pulse, and you can either feel the breath on you if you come close, or see the chest rise. And this time obviously you will be breathing and have a heart rate. So what you look to do is to put them in the recovery position. So first check pockets, nothing there, take off glasses, straighten out the legs. Obviously I'm on his right side, so you do it by taking his right hand first, put it at a right angle beside him, take his left hand and move it towards his right cheek and hold it there. You would then lift the left leg so it's bent halfway, and then you should be able to roll quite easily across. And then you can move that leg across so it flattens out. And then you would, similar to before, head tilt, chin lift. So that airway remains open, and then obviously you're free to call out. And then every couple of minutes or whatever, you can check that he's still breathing by going close, or if the chest rises, and then you can, like mentioned in the video, you can consider switching into the other side if he's on the ground for a prolonged period of time. Yeah.
Wash your glasses.
So, unconscious but breathing, like you also mentioned earlier. If I've done CPR and the patient has started breathing, this is what we would do. Put them in recovery position, keep checking that they're breathing and they're fine. Yeah? You just split again. Yeah, sure. Is anyone still on the phone?
secure.
One leg, it's just to have something there to put. Yeah. Or we have to try this one.
Pretty sure. Pretty self-explanatory.
If you compare it twice, if you
Question about the one position or when
we are using to confuse and then just try the recovery position.
after a while. Yeah. Maybe half an
Right hand side first.
If you're doing it, it's like this. So that's
One thing I'd say you guys to see here is it doesn't matter the size you are. If you follow the principle of lifting the leg, doing the procedure right, it should be possible to move anyone of any size. So even a kid can do it basically. It's just understanding the principle. So this is the choking part of our presentation. It can happen at any time, in a wedding, at home, whenever you're eating anything, it can go into the wrong pipe. This is what we usually say, it just went to the wrong pipe, and then try to get it out. The first way we would try ourselves to get anything lodged in our windpipe out is by coughing it out. If someone is coughing something out, encourage them to do so. Just keep coughing, and that might dislodge whatever is blocking it, blocking the air pipe. That's the first. Now, if the coughing has not helped, and I'm sure you've all done this at some point, is hitting the back of the person. Yeah? We'll just try to use a proper technique for this. So, for the thrusts on the back thrusts, what we suggest is using this side of the hand, and then if this was my back, so right here, I would. I can't do it. So if I would do it here, and then I would just bend the person down, and then hit here 5 times. It's quite organized, you know.
Yeah.
Just bend up a bit. So it would be like this: 3, 4, 5. Yeah. And if ideally that would have worked, and I would have dislodged any obstructions in there. I would hope that this would dislodge anything that's blocking the airway. If that does not work, then we go on to the third option, which is abdominal thrusts. So I'm going to be holding our brother Sufyan here. So first, hand go around the patient, and then pull up, inwards and upwards. So hold along this line again, here, inward, then, well, I'm going to actually do it inwards and upwards, yeah, and 5 times. That does not work, we restore. We do the hitting again, the back thrust, and then the abdominal thrust again. So we'll try watching the video just to make sure that I've not missed anything, yeah?
If you think an adult or child is choking, ask them, are you choking? Cough it out. If they are coughing, encourage them to continue as they may be able to remove the obstruction. If they're unable to speak or cough, they need your help straight away. If coughing doesn't work, slap it out. Support the upper body with one hand and help them to bend forward. Use the heel of your hand to give up to 5 sharp back blows between their shoulder blades. Then check to see if there's anything in their mouth. If there is, tell them to pick it out. If back blows don't work, try giving up to 5 abdominal thrusts. Squeeze it out. To give the abdominal thrusts, stand behind them. Put your arms around them and link your hands between their tummy button and the bottom of their chest. Clench your lower hand in a fist, grasp your fist with your other hand, and pull sharply inwards and upwards. Repeat up to 5 times. Check their mouth. If they're still choking, call 999 or 112 for emergency help. Use a speakerphone if you can. Keep repeating the 5 back blows and 5 abdominal thrusts until the blockage clears or help arrives. If they become unresponsive, open the airway and check their breathing. If they're not breathing normally, start CPR. So remember, if someone's choking, cough it out, slap it out, squeeze it out. If it's not cleared, call 999 or 112 for emergency help. Keep repeating the cycle. Start CPR if they become unresponsive, and that's how we treat choking. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
Why you put the 2 hands on it? You have to put the 2 hands on it.
It's easier.
You don't have to bend it.
No.
Yeah.
I think it's called choking, but it's not about. So what I do is I
But we don't actually have to hit each other.
right, and then using the heel, basically arm, to
strike between. So the shoulder
your airway. You're in breathing through your nose, but when you panic and you don't breathe through your nose, you're still trying to breathe through there. You're panic. And so it's a matter of staying calm and basically being able to do that. The other point is you can't say to somebody, I'm choking. So you can't say it properly. So you say, you know, and then literally being tapped and nothing comes out. But it is a painful thing as well. And it is.
But then what she said, this is probably scientific, it's not correct. She goes, she just put her hand down his mouth, just picked out the sweet, he was having a small bit. So I can understand that it's wrong. Yeah. So then, just what she was doing, she don't want us to do juicy ones, isn't it? Like scarfers. So if she was actually less down the wrong side, she was someone's mouth, changing the whole further. That's dangerous.
I think he's once done that, he'll come further up anyway. He might still
That's only this.
Two fingers and that. But that's quite easy to remember.
Oh, yeah. But every 3 months, 6 months, it's a lot better. You give it in a nice video, saying exactly what you're showing, everything.
So obviously, if they get to show you a long time, eventually they will stop reminding you. And you'll need to see.
What he said is surprising. But in your case, we have an online Saturdays or whatever.
Because obviously, you know, like,
It's a message that he
put some sort of
Right.
This happened
you know, someone's trauma.
2 weeks ago in Quwwat, this young girl, 45, went to clean the something, and it's happened. And no one knows too much about it, and then, they passed away. My sister passed away last week. Just collapsed, and things sort of collapsed, and then within 15 minutes,
your blood sugar.
64.
Ketones. Someone I know that the ketones go in up, it's not your blood sugar.
So I don't know, ambulance came that time.
I'm just asking you that.
When a person collapses,
And then just give it to the kids. So we are the ones that we are 60 kids we go about 100. So we need to make
I've seen something like that. I've not had a chance. I've got them things.
Once you use it, it's an automatically that you register automatically. Yeah, once you use it, it's automatically, so they get it automatically. Yeah, my own is in
You know the steps in simple. Steps that you're going to simple.
This is a bit of a refresher for me because I've not been to the first aid course for 20 years.
I can look
So this is for Tomorrow not? Ribbleton. Ah, Preston. Popełniono Mustang. Master. Petrol station centre. Blackpool Road, niente. Liam.
Oh, avrebbe sempre
Oh, yes.
non voleva. Comunque non hanno preso come community